Assalamualaikum and good afternoon to everyone. So welcome to today's CME webinar, proudly organized by Malaysian Society for Care of Trauma in collaboration with the Trauma Services Unit of the Emergency Department Hospital Sungai Buloh. We are truly honored to have each and every one of you with us today, and we look forward to a productive and insightful sessions ahead. Okay, before we proceed, we would like to extend our heartfelt appreciation to our anchor sponsor, the GE Healthcare, and a co-sponsor, Kuasa Saksama, for their generous support and their contributions made this webinar possible. Thank you for your continuous commitment to trauma education and healthcare excellence. This webinar is accessible via the Zoom platform and also available for viewing through the Facebook Live. So this allowing you all to join us through your preferred platform. So a few housekeeping reminders before we begin. A registration QR code will be provided at the end of the CME session. The e-certificate will be sent to your registered email. So please allow up to 1 month for processing. If you do not see it in your inbox, so kindly check your spam or junk folder. The registration via QR code will be open for 15 minutes only after the event, and e-certificates will be issued only to participants who successfully register within that time frame. So now it is my pleasure to introduce our first speaker, Dr. Natalie Chew. She obtained her medical degree from University Kebangsaan Malaysia and later completed her Master of Emergency Medicine at the University of Malaya. Driven by a strong passion for trauma care, Dr. Natalie pursued a subspecialty in emergency trauma care under the Ministry of Health Malaysia and subsequently completed a trauma fellowship at the McGill University Health Centre in Canada. She is currently practicing as an emergency and trauma physician at Hospital Sungai Buloh. Dr. Natalie will be presenting on a crucial and foundational topic in trauma care, which is a 0-point survey in trauma resuscitation. So we look forward to gaining valuable insight from you, Dr. Natalie. And without further ado, the screen is yours.
All right. Hello, everyone. Thank you, Dr. Rayu, for the very kind introduction. Let me just share this. Okay. Do you see my screen? Rayu, is it
Not yet.
not yet?
Yep.
Okay,
Yes.
the screen is displayed.
Is the screen on?
Yes, yes.
Yes.
Yes, it's up.
Yes.
Okay, great. Okay, thank you. Hello, everyone. My name is Natalie, and today I will be presenting trauma resuscitation with 0-point survey. And this is a topic that is very interesting because it goes way before primary survey in trauma resuscitation. So when we talk about trauma resuscitation, one of the most important things we have is preparedness. We always talk about preparedness because it is very important, and being very prepared will give us a high quality trauma care that may decrease the mortality rate following injuries by up to 30%. So being very prepared, getting your team to prepare will actually improve the patient's care. So if you look at the picture on the left here, we can see a very busy resuscitation room. You can see that the patient, only one, is surrounded by almost 20 different personnel. And there we have the anesthesia, we have the emergency department personnel. We even have many different surgeons from different departments like orthopedic, general surgery, and oromaxillofacial. So to bring all these great teams together, we will need to be prepared. And preparedness in a trauma resuscitation is very important because it's time sensitive and it's at high stake because we are talking about our patient's life. So efficiency is important, so is safety, and very important to have error reduction. So this will improve the outcome of all patients with a clear care trajectory. So a team of experts does not make an expert team. This is the outline of today, and what we are going to talk about is components of zero-point survey, the diverse setting where we can use the zero-point survey, benefits of zero-point surveys, and challenges and sustainability of zero-point survey. So I will talk a little more about zero-point surveys component, as this is something new, especially in Malaysia, and we can go briefly on the rest of the topic. If you look at our Trauma Life Support Malaysia provider manual, and you will see this is in one of the first chapter where in the introduction, and you will see that this zero-point survey is the first to be written, and it is the first part where we should be prepared and that we should put in mind, and then followed by primary and secondary survey. Most of us, when we talk about trauma resuscitation, we are very well versed with primary surveys and secondary survey. And so today, I would like to introduce to you the zero-point survey, where many hospitals have adopted this model, and some of us have practiced maybe parts and parcels of it, not all, but we do have some hospitals have pre-hospital notification. Many has already implemented a trauma team activation, the assembly and introduction, team briefings, emergency alerts. These have been implemented in many different hospitals as well. So zero-point survey is actually an idea or a survey that was introduced by Cliff Reed in year 2017. And since then, it has taken many resuscitation to a different level. And this is actually just a multidisciplinary idea to step up our resuscitation effectiveness. And this is where he uses the acronym STEP up to help us prepare for resuscitation. And this presentation is also heavily based on the paper from Just the Facts, Integrating Human and Environmental Factors in Trauma Resuscitation with Zero-Point Survey. So zero-point survey, what is it? So it is comprised of an acronym from STEP UP, which is self, team, environment, patient, update, and priority. We will go in detail with every one of these, but let me introduce before resuscitation. What is important is we must prepare ourselves, the team, and the environment. And during resuscitation, it is very important for us to think of the factors of our patient, the updates, and priority of the patient. And this can be repeated as clinical situation changes. The zero-point survey is a very proactive approach where we want to optimize readiness. And this is just something that we do so that our resuscitation game is very well done. And this is the time, a very protected time, where the team leader can address human and environmental factors in resuscitation. And you wouldn't have any other time once the patient arrives. So this should be done before the arrival of the patient. So let's look at the first point that we have, which is step S, self. So in self, think about yourself. So yourself as either a trauma team leader leading in resuscitation, the leader of any kinds of resuscitation, or you are part of the resuscitation team. Do you have any illness, a throbbing headache that can cloud your judgment? Are you on a medication that actually impairs your judgment? Are you very stressed? Everybody is having stress, but does this stress affect you in resuscitation? Any alcohol or drugs in the system? Fatigue, maybe after many hours of working or doing a double shift? And of course, eating and elimination. You have to eat and eliminate before the patient's arrival because we do not want our team members to be going to the toilet in between of resuscitation. Another part of self is, of course, reflecting on yourself as well, which this is way before our patient arrive. So if you need more clinical knowledge or if you need to refer to something, quickly grab it up, look it through. If there's a pediatric trauma that's coming, sometimes we don't remember all the dosage. So this is the time that we grab and we get all the knowledge in place. Write it on a board, take your phone out. Clinical skills that we must have in order for us to resuscitate our patient. And the other important things that we are actually putting into our preparation, especially in Malaysia, is leadership, where it is very important for the trauma team leader to be able to lead the team. Stress management of yourself and of your team. Decision making is something that is a very heavy burden, and it lies on the shoulder of the team leader. So a team leader has to be able to make good decisions in a timely manner. And also make sure yourself and your team members are at the ideal performance state. And what is an ideal performance state? It is a state where you can perform the best of your ability. So if we talk about like a difficult task, let's say a very difficult intubation, or putting in a chest tube, or doing a pericardial tap or a pericardial tube. So what it is a very difficult thing to do. So what actually from the study is they tell us that in a very difficult task, an intermediate level of cortisol correlates with peak memory performance, which means when you're not too stressed or not too chill and relaxed, at the intermediate cortisol or intermediate stress, you will have a peak memory performance, and it will be where you can do the best to your ability. So we want our team to be at this level where it's not too stressed but not too chill. And speaking about team briefing is another very important thing for us to have. So team briefing, as we know it, the most common and popular is role assignment, which is done in all resuscitation, be it a pediatric, a trauma, or a cardiac resuscitation. We always do role assignment because each member needs to know their responsibility. But there are more to a team briefing than role assignment, which is task allocation. Not just giving the assignment, but we need to let them know your task is to secure the airway. And so they will do everything to secure the airway. Or your task is to relieve the obstruction. And this will reduce your cognitive load by delegating the task focused procedure. So the team leader shouldn't be doing a difficult task, but instead the team leader should be leading the team. A very important thing that we don't really practice here, but is a very, very good practice, is team plans. Meaning we inform our team members what we plan to do in the event of this or in the event of that. For example, many of times, especially Asians, we think inside our mind. So if the patient come in and he's not breathing, this is what I'm going to do. If the patient comes in and his GCS is low, this is what I'm going to do. If the patient comes in and I think he has a tension pneumothorax, this is what I'm going to do. But it is all running in your mind and your team does not know it. So when you do not verbalize what's your plan, the team wouldn't know. So for us, we always come with a team A, B, C. So team A, if the patient comes in as a pre-hospital care announcement, same findings, the patient did not deteriorate, we will do this. This is our plan A. And our plan B will be, let's say the patient comes in and the patient is now currently asystole, there's no spontaneous breathing. And so this is what we're going to do. So the moment the patient comes in, the team leader will shout out, okay, change of plan. We are going to plan B because patient is currently without a pulse and without a spontaneous breathing. So we will do traumatic cardiac arrest resuscitation. Or you can tell them there's a plan C, where patients comes in better than what was told by the pre-hospital care. So your patient comes in currently GCS full, good vital signs, no free fluids in the abdomen, very well. So this is our plan C. So these plans, when we tell it to our team members, then they know your train of thoughts and they will be able to catch up with the team leader. Another important part of the team is team activations. So trauma team activations, which is very, very important so that we can get all the important team members down. There's also activation of massive transfusion protocol or targeted transfusion protocol, depending on your hospital, and these are important. Between team plans and team activation, if you have checklists and you have cognitive aids, all this will help you and it will smoothen your resuscitation process. So Another important thing about team is you want to have effective leadership where you have the best quality in leadership, and this lies on the shoulders of the team leader. Other than that, we also need adaptive coordination and teamwork dynamics, and that's between the team, and the team has to learn how to work together. Sometimes we will have team members that we have worked together for a long time, or sometimes you will have a new member to the team where they are recently transferred or just introduced to the team. And that's where it is very important for us to have a common language, because we need to have a shared understood terminology. We cannot be shouting out abbreviations during resuscitation and your team member does not understand it. So a common language is very important in our team. So it's closed loop communications and graded assertiveness. Graded assertiveness is a structured approach of communication to address concern. So if the team member feels that the team leader is giving the wrong dosage or giving the wrong medication, they should be able to have this channel to communicate with the team leader about their concerns. So there shouldn't be a big hierarchy gap where the team members cannot voice out their concerns. And of course, conflict management and situational awareness, which is something that is not very commonly practiced in Malaysia. So situational awareness is having accurate understanding of what is going on relating to the situation that you're in, meaning at all times and at any times, the team members should be aware of the situation, should be aware of what is going on with your patient. Meaning, if we are intubating the patient now, everyone in your team should know that yes, we are intubating now, because we don't want somebody to be putting on a CBD at the same time, or we do not want the radiographer to come in to shoot a chest X-ray while we are intubating the patient. So therefore, when there is a situational awareness, it will be a seamless resuscitation and every part of the team can work seamlessly together. A collective orientation is a propensity of work where it's collective manner in the team setting, meaning that we are all heading to the same directions. So that is very important, something important in our team here, so that we understand each other and we know exactly what is going on. So after team is environment, the E. So the environment that we have in Malaysia, of course, with the emergency departments overcrowding and so many patients coming in, but we have no choice. But we have to prepare our clinical environment, because a good clinical environment will be able to give you a good outcome in a patient. So what is a good clinical environment? An environment where the noise level is not high, which is low. We want a low noise level so that when the team leader calls out an instruction or a team leader is asking for a feedback, the team members will be able to hear it. A number of personnel in the room. So of course, in interesting cases or a very bad trauma resuscitation, many personnel will come to help. Many bystanders as well, while they're passing by and they are curious and they want to know what kind of cases are we resuscitating. So it's actually important for us to limit the number of personnel in the room. Only the need to be there personnel should be there. Lighting is important so that we are able to see what we are doing, especially when we are doing a procedure, and also identifying dangers that could be around. Dangers from our equipment, dangers from sharp. Talking about equipment should be readily available. The room layout should be very ergonomic, with all the labels being labeled out nicely, and maybe certain things could be bundled together so that it's within reach, that we can reach it very quickly. Every team member knows where the things are placed. So let's say I want to take a Ducanto suction. My team member will know exactly where it is. Every team member should know where it is, because we do not want to spend the precious time searching for a catheter. So this is something that many of us will have to do. Checklist as well. Resuscitation checklist. Before our patient goes to imaging, the checklist, has this been done? Is the airway secure? Does your ventilator have enough batteries? Is the is the infusion pump running well? What medications do we need to bring? Are we bringing our backwash mask around? So that is the important thing of having a checklist. So other than that, we need to have safe environment, organized resuscitation environment, hazard identification, equipment optimization. If you have a whiteboard, use the whiteboard, and we should have a good workflow. I would like to show you the DCR suite, which is damage control suite that we have in Hospital Sungai Buloh. If you look at here, this is a suite that is put on together so that we have a very ergonomic workflow here, where all the equipments are put at the back. Here is the venous section, suction, trolley, and our patients are placed in the middle. And if you look closely, the lightings are good. It's nice and bright. All your monitors are up. Your ultrasound is on the right side, within reach from you. And when you don't need it, you'll be able to push it to the back. And these are important to put them in their own place. And so your staff will know where every place things are placed. So you know where the cottons are, you know where the gummies are, you know when you need to irrigate, you will pull the irrigation trolley. And if you look at here, the ventilator is always at the same station, emergency resuscitation trolley and pediatric resuscitation trolley. So things are always placed at the same place and things are always where they belong. The next one, P, which is patient. So the thing about patient is when we look at our patient and we say, okay, let's do a primary survey, and the primary survey is done beautifully, it's usually done efficiently. But when we look at our patient again, then oops, we might have some challenging situation where we need to anticipate. So in special population, like the pediatric population, they are very different from adults. And we have the geriatric populations where the aging and the aging process has accelerated all the difficulties for us. We also have patients who are on anticoagulant where they bleed easily. So these are the patients where we will have to think of extra. Are we reversing the patient? Do we need to order extra platelets for them or extra fresh frozen plasma for them? Pregnant ladies, pregnancy, that means we need to call the ONG team early, and we are balancing between the surviving fetus and the mother, and we will want to be able to bring in all the relevant team for our patient. Morbidly obese patients are a challenge, and we are having more and more morbidly obese patients nowadays. So if you know, let's say the pre-hospital care activation or pre-hospital care alert has told you that this patient is morbidly obese, prepare early, get help, get in your CMAC, get in all your towel rolls, and be prepared for it. So all our care, all our trauma resuscitation should be individualized. They should be tailored to the need of your patient, and it is not one plan for all. For updates. So updates is something that we don't really do here, but it's very, very important, especially during trauma resuscitation. It's very easy for us to lose sight of time or resuscitation trajectory because we are so focused in doing certain things or wanting certain things to be done. Sometimes we don't forget it. And there are times where you are doing certain things and you look up, oh, 30 minutes has passed or 40 minutes has passed and your patient is still not stable. So this is where situational awareness is very important. This is the time or this is the place where the trauma team leaders regularly shares a quick update on the patient status. So a simple thing that we can do is like a 10 seconds update every 10 minutes or 5 seconds updates every 5 minutes. And this should be done by the team leader so that all the team members are aware of what is going on. So for example, at the interval, you can say like, okay, team, quick update. This is a 30-year-old gentleman, motorcyclist hit by a lorry. He was brought in with no spontaneous breathing, and we have successfully intubated him. And next, we would like to complete our EFAS and ensure that there's no pneumothorax. So this is just a very quick update, 10 seconds. And you go about, do whatever is needed, and then we can update again 10 minutes later on. And so this is very important so that we have a shared mental model so all your team members will know exactly what we need to do. And priority. At many times, different patients will have different priority, which means it's the priority of this patient to stop the bleeding. Is hemostatic control the priority now? Or is bringing the patient to imaging the priority now? Or are we prioritizing sending the patient to the operating theater? So if a patient comes in with the arterial cut, what is our priority now? Are we stopping the bleed first, or are we just bandaging him and sending him straight to the OT? So that is something that team leader needs to establish and needs to inform the team members so that everybody can pack the patient and work their way towards the goal, whether it is going to the OR or going to the radiology or going for international radiology procedure. So this is something we need to do. And we also know that the patient situation is very dynamic. So update and let the team knows what is your priority at this time, because priorities can change rapidly. So now that we have finished with our 0-point surveys and all the components in them, where can we practice a 0-point survey? We can practice it in a very diverse setting because it's just a concept for us to improve our resuscitation. So it can be done in an air ambulance, in a land ambulance. It can be done in emergency department regardless of what resuscitation we are doing. It can be done in the ICU. It can also be done in the operating theater if the patient subsequently deteriorated and needs a resuscitation, and it can also be done in a wilderness setting. So are there quantifiable benefits for a 0-point survey? As far to now, the 0-point survey does reduce time to critical intervention by 45%, and it improves the team performance by 80%. By practicing 0-point survey and having preparedness before your resuscitation improves patient outcomes by 30%. Is there an increased safety? Definitely. But how much safety has increased? That we don't know. Not many publications and not many clinical studies have been done to quantify the benefits of 0-point survey. So what are the challenges if you want to implement, let's say if your center does not have 0-point survey and you want to implement this in your center or in your department? One of the biggest challenge that we will face is resistance to change, because change is difficult and people do not like change. But changing for the better, changing to improve the outcome of your patient, that is the important part that will drive the change. Lack of time and resources, and there are more resources that is needed, and definitely you need to have you need to have a protected 5 minutes at least, or 10 minutes for you to prepare a 0-point survey. Of course, there will be difficulty in changing established protocols. It will be difficult as well for you to maintain long-term to put up a new survey and you want to put up a new concept. So long-term compliance will be difficult, and there will be difficulty in measuring its effectiveness. Like I said, we do not have much of a clinical trials or audits or any sort of study to any sort of study for this. So sometimes it's a bit difficult for that. And I think I accidentally clicked something. And for the sustainability, in order for us to sustain a 0-point survey, we definitely need education and training. The education and training is very important because we are introducing something new. The protocol development and integration is important because we need to integrate it seamlessly into your department and into your current resuscitation. So it has to be integrated well. You need champions to support your movement. You need champions, you need leaders to be able to push this project forward. You need resource allocation for the training and for you to do simulations. We also need performance monitoring and feedback so that we know what works and what doesn't work and how can we improve ourselves. So the continuous improvement and the adaptation of a 0-point survey is also very very, very important for us so that this is sustainable in our practice. So how do we do it? There are many different tools and many methods for us to do it. And the strategies of coordinating trainings and trauma team leader trainings, doing simulations, those are the common tools that we have to do it. So in summary, optimizing preparedness with 0-point survey actually improves team performance and it also improves team outcome. So 0-point survey here with the 6th component of step up is a good tool for us to improve our patient's outcome. These are my references. These are the papers that I've used to base on. So with that, I thank you.
Thank you very much, Dr. Natalie, for the informative and clinically relevant presentation. Your explanation of the 0-point survey has certainly deepened our understanding of the importance of the preparation, teamwork, and also leadership in the trauma resuscitation. So, ladies and gentlemen, we will now take a short break before we move on to our second session with our second speaker. So please stay with us. We will resume shortly with our next speaker. Okay, thank you everyone for staying with us. So I'm honored to introduce our second speaker, Mr. Terence Liam, a certified master trainer in neuro-linguistic programming and a member of the Advisory Council of the American Board of Neuro-Linguistic Programming. With over 20 years of experience, Mr. Terence is a highly respected expert in human behavior and personal transformation. He is the only trainer in Malaysia conducting neuro-linguistic programming trainers training and master trainer programs and has mentored many of the country's leading neuro-linguistic programming professionals. Mr. Terence works extensively with leaders, professionals, and business owners to facilitate performance breakthroughs and promote sustainable personal growth. Today, Mr. Terence will be sharing on the topic neuro-linguistic approach in engaging trauma team communication. Without further ado, Mr. Terence, the speech is yours.
Well, thank you, Dr. Rayu. Welcome everybody. That was a really nice introduction. I've been teaching NLP for, gosh, about 20 years. So I've just dated myself. Let me just share my slides with you, and so you can just follow along. Okay, everybody could see this all right? And you could hear me okay, yes?
Yes.
So we don't have a lot of time, and NLP is really a big body of knowledge. And so we're going to cover quite a lot of stuff, but I'm going to just give you all the gist. Taking from what Dr. Natalie has mentioned about the 0-point trauma research and talking about preparing the self and also preparing the team. And so I'm going to touch on the NLP approach to team communication. Now, when you think about NLP, in a nutshell, what really is NLP all about? NLP is about understanding how the human mind process information, how we human being, how do we process the information that we receive via our 5 senses? That's number one. And it's also to talk about the affect change in the human behavior. So many people learn NLP for different reasons. And if you really think about it, it's really you understanding you so that you know what kind of changes that you can make internally, that's for you, or the way that you communicate with others and how you affect a positive change in people's behavior. So all the NLP techniques that we talked about that we learn in a full-on certification. And there are 4 levels of certification in NLP. You have the first layer, which is the beginner's level, which is called the practitioner. And then you move on to the second, the advanced level, which is the master practitioner. Then you become a trainer, and you end up at the 4th level, which is a master trainer like me. So if you're looking at the NLP communication model here, this model is the basis of all the NLP techniques. Every technique that is derived that you can find in NLP has its basis here. So very quickly, just have a look at this. We start off with an external event. This external event can be anything that happens in our environment. And the only way we receive all this information is via our 5 senses. And if you know, and if you walk on earth long enough, then you realize that all our 5 senses are designed to be outward looking for a few simple reasons. One is so that it keeps you safe. So that's how a human being receives information from the 5 senses. And once anything that happens in our environment is received, and once it goes into our mind, we have a bunch of filters that will filter out the information. So some research shows that it was 11 million pieces of information that you get per second and all. It's just a large amount of information that comes to us. And what your filters does, which we will not go into all the details of the filters, but what a filters does is that it either deletes off certain information, or it will distort certain information, or it will generalize certain information. And this is generally the function of the filters. So deleting information can be anything that if you seated in wherever you are, did you notice the pressure on your feet as your feet is touching the ground? Well, if you did not until I mentioned, then those information were deleted. Why do we do that? There was a number of reasons. One of it is that it's not related, it's not important for your survival. So it's just got deleted, or it based on what your concentration. A distortion happens when we interpret stuff. And what happens is that when you hear a certain phrase or a certain word, different people have different interpretation. This was an important point that Dr. Natalie talks about, which is you do not want to use simplified acronyms in your case, it's a very dire situation, an emergency situation, where you're in a high stress situation where you want to make sure your communication is clear. Because different people will distort things differently, as in the information. This distortion is basically based on a number of things. If you could see the filters inside all the small boxes, it could be things based on your languaging, your memories, your upbringing, your values, your beliefs, even the way you perceive the world, or certain decisions that you have made when you were a child. And it all influences us. Generalization is not a bad thing. Generalization is the basis of all how we learn stuff. But we do have a tendency to generalize things, especially if the same thing happens to us 3 times or more. So if you ask anybody that comes into the office and says that nobody listens to me, or nobody wants to follow my instruction, and if you ask them specifically, who, and they usually will name 1, 2, and 3, and that's it, they will stop there. That's generalization. So every time when you get somebody who says nobody or everybody, it's usually 3 times. Yeah. So what happens is that it goes through the filters and it ends up with this thing called an internal representation. Again, NLP jargon. An internal representation simply meant that this is how you represent your external world internally. And how do you represent it? You represent it in a form of a picture. You see it in your mind. And this internal representation in our NLP training we place a lot of emphasis on it for our practitioner, We get them to focus on this because whatever that is left from the filter is very, very small number. And this accounts to what you are focusing at that moment. Now, this is important because the internal representation that you have will affect your emotional state, will affect how you feel, will affect your thoughts. And if you see the arrows that is intertwined, the state, the emotion that you have will also affect your physiology. Basically, your body. This is where all of you are an expert in this. The physiology, where the heart pumps and the blood flows and the pressure, the blood pressure goes up or goes down, things like that. So it affects that. And what happens is it becomes a loop. The internal representation is what you focus on. It causes you to feel a certain way and your body respond or your body react. And the reaction of the body will reinforce the thought, reinforce the feeling, reinforce what you focus on. So this is important if you want to understand how you behave. So in NLP, we look at the whole idea of how the internal representation affects the state and the physiology, and that you see the arrow produces a behavioral response. So if somebody sees something external and have a mental picture inside, and it happens in a split second, and that mental picture is a negative picture, it's a picture of something they do not want, then what will happen is that they will have a feeling and the body will react according to what they focus on and what they feel. Now, you probably know this because if somebody is thinking, if somebody comes into the hospital, how many people actually comes to the hospital because it's good news? Not a lot. And those who end up in whichever department, especially if we're talking about trauma, is not going to be good news anyway. The family members or anybody that comes in there, the patient's family or whoever that shows up there, have an internal representation. They have a picture in their mind and they are not even aware of it. 90% of the people are not even aware. It causes them to feel very differently and the body will react. And you as the physician are able to notice that. And what do? You go over there and you calm them down. You tell them to sit down or you say, let me talk to you. Your tone changes and all. Why? Because when you do that, when the picture switch, the behavioral response changes. And that's what NLP is based on. The technique of NLP and the understanding of NLP is based on. I'm giving you a very quick, simple, easy way to understand this. When you come for the certification, we're going details, bit by bit. So understanding this, what happens inside the mind of the person, allows us to learn how to respond differently, allows us to affect change depending on what we want to achieve. So here's something that is interesting. Based on this, and I mentioned this, that we think in pictures. And here's something for you to think about. You cannot not think of anything that I say. You can't. So if I say apple, you have a mental picture. Now, some of you will actually see the fruit apple. Some of you will see a product of a brand. Yes? If I say green apple, you will see a green apple. Now, here's even more intriguing is that it doesn't matter if I say it as in apple, the green apple, or I say don't think of an apple. So if I say don't think of a blue tree, you're still going to think of a blue tree. And that's what's happening in the mind of all human beings. You can't block whatever that you hear because you think in pictures. It will have to appear. Now, for those of us, the easiest example we could give is if those of us who are parents, you will know what I'm talking about. If the child is running towards the front door and the door is open, what are the usual statements that a parent will say? What is it that you will say if you're the parent? Don't run out there. guess what happens to the child? In the mind of the child, all they see is the picture of running out there. That's because our mind doesn't have a picture to represent the word don't. Now take that into where you are doing whatever you're doing in your work. You have to learn to speak it the way you want it to happen. Many a times we understand. Consciously, we understand what it means to don't do something. We understand it. Cognitively, we do. Yet, in the mind, even though I understand what it is, I will always have the picture because the word don't doesn't have a mental representation. There's no mental image here. So the next time you think about communicating with people, and which we will go into the communication part, the next time you think about communication, you want to be very mindful of what you're going to say because it will affect the change. Now, from an NLP standpoint, anybody learning NLP who have to understand two things. The way we teach, our school teaches NLP is the practical application of you being able to master your work. So the people that learn NLP for personal development, it's really about you understanding how you communicate within yourself. Do you do self-sabotaging statements? When something unpleasant happens, what is the first statement? Do you catch yourself in your own internal dialogue, your own self-talk? Yeah. Do we say, oh my God, I can't do that. Oh, this is bad. I am so stressed. Do you catch yourself? And this is important because the moment you mention that, it tells us that you are having an internal representation of a picture that you are stressed, and that causes the reaction. As opposed to something unpleasant happen or an obstacle happen and you say, I can get over this, or I can find the solution, I can go around, I can ask for help. It's completely different behavioral response that comes up. And this is one, personal development. And all personal development courses supposed to increase your awareness of all the unconscious behavior that you have. Guess what? The other thing about learning NLP is to help people able to master their work. How? Through the process of me communicating with you, through the process of coaching somebody, through the process of guiding somebody, through the process of mentoring somebody, but still from the form of communication. So here is where precision of language is important. The words you use and the structure of language is something that you really want to master in if you want to get very good result with the people that you're with. So NLP communication talks about that. It's really about focusing what is it that they are focusing on right now and looking at their behavior and what change do I want to affect. Okay. Now, let's go to team communication, and now we zoom into the team communication. And why is the team communication so important? Well, in your case, as we talked about just now, that is the team preparedness in order to be able to do a trauma resusc, right? Hinges on not only the individual being totally prepared, you're all trained professionals, so obviously you will be prepared. The team preparation hinges a lot on how we communicate with each other. Why is this important? Why is team communication so important? I spent a good 15 to 20 years training teams and development of the teams and how the team grows and become cohesive. The simple reason is there are two. One is that because you want to reach the same objective. And everybody knows this. If you go to any kind of team building event, everybody will be talking about having the same vision, going the same objective, fulfilling the same purpose. And that's all good. The principle behind it is this thing called the point of coherence. And this is seldom spoke of. And in any team building also is seldom spoke of is the word contribution. These are the two things that is most of the time it's not mentioned. The one that makes you part of the team is the amount of contribution that you have. And that's key. So we talk about this point of coherence. What is a point of coherence? Is when everyone is focused on a target, a same objective that you have. Now, this can be established through your briefing before anything happens, and this can be established through as you're communicating when you're running your processes. So the point of coherence is really harnessing all the focused attention of achieving a goal. Now, if you think about it, if a team can have everyone focusing on the same point of coherence, you will find that it's easier to achieve the objective. If an organization or a department, everyone in the department has the same point of coherence, then the department or the organization will progress. It's the same with the nation. It's the same with countries. When you can pull everybody to focus on one point, the point of coherence, that's when you actually make the progress. This is number one. The second reason why team communication is important is so that you could pace the progress. Now, achieving a goal has its process. There are many moving parts in us getting somewhere, especially if you're patching somebody up, if you're putting things together. You have to pace the progress. The problem comes when I do not know where are you in that progress. And because we are interconnected, the pacing of the progress, if it doesn't happen, it will cause a delay in response time. And an example will be if one party is involved in doing something and is sequential, I need you to get this done before someone else can do something. And we do not know where you are and that I can't do all the preparation or I can't get myself ready to act the moment you pass it over. And so the pacing of the progress is a very important element. Now, I liken this, the same objective and pacing the progress. One of the examples we usually give is that if you go to a restaurant, you're talking about fine dining restaurant where you have full service, the crew. At the kitchen, in between the kitchen and where the guests are, there's always a person known as the expediter. The expediter are the one that keep tracks of the orders and also know what comes out, what comes through from the kitchen. The expediter is the one that will put everything in place and will notice and then only pass to the server and say, serve it right now. You could imagine the expediter not there, and if nobody is communicating with the expediter, there is no way that he's able to function and get the food served for the guests. And that's really it. So your team communication is key for these two reasons. Now, we know this, we've done this. The question is this: why is it that sometimes we still have a bit of lack in terms of our communication? Well, there are some hindrances. One of the hindrances in team communication is we think that everyone is inside our head. Now, this sounds like a joke, but it is. If you do not believe me, go back tonight, wherever you are, ask somebody to give you direction. Hey, how do I get to somewhere and somewhere? How do I get to, PCB in Kelantan? And listen to the way they tell you. Listen to the way that they communicate. Or catch yourself when you're giving directions how to get to where you are or how to get to a place, a restaurant, a location. Do we say things like, if you go straight and you turn right, then you'll be able to see the building? Who's right? Which right? from which direction. And there is a tendency like to speak this way because the world that we see is based on our eyes. And we make the generalization that everybody could see what I see. And this is key because if in the team, and if this really happens, that's one of the reasons people don't communicate, because we make the assumption that people know what I'm doing this. You should know what. Simply because there is a lack of awareness that not everybody, in fact, there is no one else other than you that is inside your head. That's number one. The other one is they should know what I'm doing because they gave me the task. Or they should know what I'm doing because I have taken up the role. Well, the problem isn't whether they should know or they shouldn't know. The problem is the pacing. Where are you in your task? Where are you in your role? Where are you in your progress of your part, one of the link? And this should know. Well, unfortunately, we learned this a lot when we were much younger, when our parents and our school teachers tell us that we should do this, we should do that, we should know this, we should know that. One famous thing that we hear a lot in parenting is, this is common sense, what you should know. Yeah? But it is. It isn't like that. So we think that people should know. There is a small percentage of people who think that my part is too insignificant to even mention. I'm doing a simple procedure, that's all. I'm just getting certain simple stuff, that's all. And this too can be a hindrance simply because what you think as insignificant is really the link, the critical part of the link. It doesn't matter whether the link is a small link or a big link. It is still a critical component of it. So some people think that it's insignificant. And if from NLP, if we go and we investigate further, people who feel that their part is too insignificant usually have problem with self-esteem. And you need to go and get coaching if that happens. And the last hindrance is their meta programs. Meta programs are our filters. I do not know how many of you have heard of meta programs. It's one of our preference. It's an NLP technique that we teach in the advanced level. And all of us have different preferences. The part that has the hindrances in team communication is because the meta program of the individual. Now, it's not wrong. Meta programs, there isn't a right or wrong. It's just how you prefer to function. It's not cast in stone as many people think it is. Personality testing is never cast in stone. Why? Because human beings can grow and human beings are dynamic. You are not to be put in the box. So the meta programs here can be the individual is a non-global thinker, means that they prefer to go very specific in just looking at their own role. They have less tendency to look at big picture. And this can be a hindrance in team communication because if you don't carry the big picture, the main objective, the point of coherence, then it's very hard for you to want to communicate because you don't see the connection. So it's a practice. If the person has the meta program of the person is non-global, they need to put in a little bit more effort to practice asking themselves, I am doing this so that I can achieve what? I'm doing this so that I can achieve what? So that's what it actually means. Yeah. So then what do we do? Well, the simple answer that everybody will say is communicate more. How do you communicate more? If I can suggest to you, in whatever capacity you are, if you're in a team, The first thing is that you need to do is that you need to acknowledge. If you're given the task, you need to be the one that acknowledge. So if somebody says, Terence, you're in charge of this, I will have to acknowledge, got it. Yeah. So acknowledging and then updating. That is something that I have to decide to do. Because at the end of the day, nobody can force you to do anything. Because you have to be the one that wants to make the decision to do this. So I acknowledge, and when I'm doing my work, my role, my task, I will be updating. If I'm finishing, I'll let people know I'm going to be finishing this. I'm going to be able to pass over this to whoever. And the solution here is acknowledge and update, because people's behavioral response is really based on the pictures in the mind. So if you say you're finishing whatever that the task you're doing, I would have a mental picture in my mind, and I will know to get ready to take over and move the sequence. And that's really the solution. And it's based on the picture in your mind. But remember, you always say the way you want it, not the other way. Okay? So that's the NLP approach to team communication. I hope this gives you an idea. Obviously, there are more things that I could tell you that is in a deeper. I leave it to you and see whether you have any questions or not.
Thank you, Mr. Terence, for your inspiring and informative presentation just now. So we greatly appreciate the valuable information you have shared to enhance the team communications in our life, in our working area. So now we come to the question and answer sessions. So we welcome any questions from our participants, whether you are joining us in Zooms or Facebook Live. If you have any question, please feel free to type into the chat box. And kindly you indicate which speaker the question is directed to. And we will do our best to address as many questions as time allows. So because we have only about, I think, 10 minutes in our Q&A session. So I have a first question here to Dr. Natalie. So the question is, what is your advice which you give to the emergency team who are new to using the 0-point survey?
Okay, to anyone who is new in using 0-point survey, my advice will be do the education and training. So find out exactly what is 0-point survey, what are the components in it, and train your team. You have to do simulations, you have to train them. So it's gonna be like you have to do the same thing over and over again every day. So whenever you are scheduled as in trauma, or you're scheduled as the team leader for the resuscitation, just take time and run through it. It doesn't have to be anything fancy. You just need at least like maybe 5 minutes before your patient arrives with your team. So that we know, because of the work schedule and our roster, our team member changes all the time. So just do it every time, and over the period of 2 to 3 months, your team will get used to the 0-point survey, and they will know that we will have to do the 0-point survey before our patients arrive. So that will be the cheapest, cost nothing, and the easiest way to implement. And when you find that that is helpful, and that there is a way that we can do, then you can integrate it into your current protocol in your hospital. So doing the education, training, and simulation, just keep doing it. That will be the most helpful way for you to start the 0-point survey.
Okay, thank you, Dr. Natalie. So for Mr. Terence, there is one question for you. How can team leaders use NLP to keep everyone calm and focused during a trauma case?
How can NLP communication model? Here's the thing about about communication. there was 2 studies that was made in communication, and both was 10 years apart, and looking at what are the components of communication. And what they found out was that only 7% of what your communication accounts to the words that you use. Now, I didn't say the words are not important. The words are very important because the 7% creates a picture in the mind. The one thing they want to do is that if they are all present among each, means they're in front of each other, right? 55% of the communication comes from your body, your facial expression and your posture. And 38% comes from your tone of voice. So how can a team leader keep everybody calm in a situation where it comes in, oh my God, people are screaming or whatever it is? If I increase my volume right now and I go out and I speak like that really fast and I'm stressed myself, which you can see from my expression, then everybody's going to be capturing that. It's going to influence them. So the way to do it is that you got to train yourself to be really monotone. How do you train yourself to be monotone? You just mimic, you model after your lecturer. Monotone. There is no expression. And that usually comes, and then you have to learn to speak it at a slower tempo. Just slow it down. So if I'm speaking really, really fast right now, then you got to be able to bring it down just a notch. But your 7% of words have to be very precise in exactly what you need to be done. So that's how you do it.
Okay.
So we say that I can not rush through a procedure, but my hands and legs can be very fast. Very different.
Okay, thank you, Mr. Terence. I think I got another question for you, Mr. Terence.
Okay.
Okay. Just give us a simple NLP technique that we can use as a everyday to improve we as a team leader when we want to communicate with our team members. Is there any one technique that you think is very important for us?
Okay. So this one you gotta practice, yeah? This like a 1 minute practice a day. So if you can do that, then you'll be really, really great. So one of the technique you can do is you have to ask yourself, and doesn't have to be related to when I'm at work, in the hospital, whatever that is, or out in the field when the incident happens. So, but what you want to do is that on your way to work, or when you get up, and you have to tell somebody something. You ask yourself for just 1 minute, you just take one thing, and you can do it hypothetically, means you can look at it and say, if I'm going to tell this person how to cross the road, what would I say that will produce the most positive outcome? Yeah? What will I say that will have the most positive outcome? Means what is it that I want to see achieved, and how would I say with the least amount of words that will produce the same amount of outcome? So that's a practice. But remember, you won't be successful the first time. So it's 1 minute a day and you got to practice. Here's my question. Who is really good in the hospital? Who is the best in taking blood?
Housemates.
Yes. Why? Because they do it every
They
day.
do the most, yeah.
They're doing so much that they having muscle memory. I don't know how you guys do it, because I wouldn't. You give me a needle, I think I'm going to poke all the wrong places. Yeah. But they do it beautifully. Yeah. Not the new ones.
Yeah.
Not the new ones. Yeah. Not the new
The senior houseman.
ones.
Okay, I got one question from the chat box here for Mr. Terence also.
Okay.
What can we do to build a good communication within a team in a short period time with a total strangers?
Good communication. Total strangers, are you talking about with the new report? Somebody just got transferred and is new in your team?
Yeah,
Or
maybe
you're talking about with
some
family members of victim, not victim, we shouldn't use victim,
The
patients.
family members lah. Okay, maybe both of them.
I think the question meant the new team members who just got transferred. Like they
didn't mention
don't
lah,
know
but-
this person and suddenly he's in the team.
Okay, so the key word here is the technical jargon is called rapport, R-A-P-P-O-R-T, yeah, rapport. But don't think too much of the word itself. Think of what the word means. The word rapport means trust and responsiveness. Means if I have rapport with you, I will have trust and responsiveness from you. Now, you won't respond to me if I don't have trust from you. But rapport works both ways. So if it's a new team member that comes in, you need to very quickly build the rapport. How do you do that? You do it, I give you the shortcut version. The level 1 that we train them is you basically mirror everything they say. There's a lot of things that you can mirror. But you can do this very quickly by just asking one question. Ask them this, and they're coming into whatever it is. I don't know, they transfer department, whatever. I don't know your situation, but this is what I will ask. What is important for you? And then fill in the blank. Means what is important for you as a, I don't know, trauma physician? What is important for you as a doctor? What is important for you joining us? It doesn't matter what the blank is. What is the front part is the key. Because when you ask somebody what's important to them, they tell you basically the values that they have. And values is very unconscious. You match that, you have trust and responsiveness. You can do that with a total stranger. Anybody on the street, really. Hey, I'm just curious. What's important to you about the work that you're doing? If I ask you that, Dr. Rahayu, you go tell me everything that how you journey in your life. Yeah.
Okay. Okay, thank you to Mr. Terence and also Dr. Natalie. Due to the time constraints, so we will have to conclude our Q&A sessions at this point. So thanks again, Dr. Natalie and Mr. Terence. And thank you also to the all our audience and also the questions from the participants. Okay. Okay. So as we come to our end of today's webinar, on behalf of the organizing committee, I would like to extend our heartfelt gratitude to all of you for your participations and also engagement throughout this session. And then thank you.